That's correct.
Okay. And number two?
And number two is that the training that was described in the GAO report is in fact in place and has been done in the vast majority of our places. We have begun a process of certification for all of our technicians. We have developed an institute or an academy of SPD where we bring people specifically down to go through the training process. We require that every SPD document the fact that their people, their technicians, have been trained on the instruments that they're responsible for reprocessing. And I believe that the last look that the IG made at how well we had done with that training indicated that we were close to, but not yet perfect in terms of the number of people that were trained. In other words, there were some instances where they found no evidence of the training, not that the training hadn't been done, but no evidence. So that's number two, is that we have indeed set up a process for ensuring that our people are properly trained. And then the last item that I wanted to discuss in the GAO report is a central office oversight. Again, a point that we agreed with, that we need to have in place the mechanisms that allow us to be assured and are able to assure our patients and you all that we are periodically looking at the SPD and how it's functioning and assuring ourselves, you all, and the public that indeed those things that we say need to be done are being done, the training, the following standard operating procedures, etc. As I mentioned in my oral testimony, there are 4 levels of oversight that occur in the SPD. There is a local requirement for oversight. We changed the reporting structure in SPD to a clinical person, the nurse executive in the executive quadrant. We require that the networks periodically, 3 times a year, inspect the SPD using a standardized assessment tool, which I think most people would agree is probably a benchmark standard within the industry. Then we, from central office, do our regular periodic inspections of the SPD for both infection control processes and reprocessing. And then finally, as mentioned, there are a number of outside organizations that periodically look. The IG does their combined assessment programs that include looking at the SPD, and that's done every 3 years. The Joint Commission looks at SPD. The medical inspector periodically looks at SPD. We have an internal source process that looks at SPD. So there is at least 9 levels of oversight of SPD right now.
Let me, and my time has run out, but comments, I think in your opening statement, continuous improvement, dozens and dozens of reviews annually, careful assessments. You talked about 4 levels of oversight. I think GAO talked about inability to follow guidelines, a need for unfettered input from employees. They found disturbing deficiency and systematic problems. You said you've begun a process of certification. If you do all of those things and your managers don't follow the rules, what do you do with those people?
We would discipline them.
Have you?
We have.
Have you fired anybody?
We have proposed removal in a number of instances, and almost invariably the individual has resigned or retired as a result of the proposed removal.
Can you give us a number, I mean, of individuals that you've proposed removal of?
There are, I believe, 3 physician or dental level people that that's occurred with, several chiefs of SPD where that's happened. We have also reprimanded individuals, suspensions, and letters of counseling.
And I think one of the dentists was in his 80s. Is that correct?
Close, yes.
Mr. Filner.